For those of you who are with us for the first time today, the NMDOH Consortium is a statewide effort aimed at advancing the integration of non-medical solutions into the healthcare delivery system so that we can improve health outcomes and reduce health disparities across the state. Our first year showed us that this work is needed and timely. There is growing momentum across the state of Texas around the integration of NMDOH into the healthcare delivery system. We are seeing health plans, providers, and health systems invest in non-medical interventions on behalf of their patients. And in response, a growing number of community clinics and health professionals are implementing a variety of programs to improve conditions that have a negative impact on the health of their patients. The Texas Consortium is a dedicated space for all stakeholders to come together to share, learn, and support what is working and to build a field of practice for NMDOH in Texas. Early this year, we are focused on populating our NMDOH program index, which you may have heard about last year, and this is our re-promotion effort. We are cataloging NMDOH programs, which are services and resources offered to patients of health system organizations, including plans, providers, and hospital systems. The index features abstracts of programs with searchable fields, including program sponsorship, drivers of health, target population, health conditions, location, and evaluation status. Our goal for this index is to serve as a resource for anyone working in this space to know what's happening, where, and what's working across the state of Texas. But the program index will only be as robust as we make it together. So I'd like to invite you all to carve out 15 minutes of your week to take a look at the index and send me an email to get started submitting, where you'll showcase the work you're actually doing at your health site. The link to the program index is in the chat along with my email. If you have any questions about the program index, don't even hesitate to reach out to me at that email. Now, let's get to the good stuff, our session for today. Today's presentation is about the Community Resource Referral Platform, Unite Us. We will have time at the end for a Q&A session, but along the way, feel free to put your questions and comments in the chat, and we'll make sure we address them when we get to the time. At the end of the meeting, I will also put our link to the program index in the chat and encourage you to bookmark and send us your abstracts. Without further ado, I'm excited to introduce Jordan Murray, Strategic Sales Director for the Southwest region at Unite Us, who will introduce our speakers and kick things off today. Over to you, Jordan.
Awesome. Well, thank you, Jackie. And I guess still good morning for most. I'm here in Austin, so I think it's probably still morning for most everybody that's joining. I am going to go ahead and kind of kick off. Hopefully you can see my screen. And I'm going to go into, I'm going to move some stuff around so I can have visibility on the whole screen. How are we looking there? Thumbs up. All right, perfect. All right, well, first and foremost, thanks for everybody for joining today to learn a little bit more about Unite Us and really how we can help support your organizations or partner organizations as really your partner in social care. This is a brief overview of our agenda here. I know we really want to help drive as much discussion as possible. So for those of you that know me, I apologize in advance because brevity is not my strength, but I'm going to try to do as good as I can because there is so much depth to the work that we do. But really would like everybody just to have a good overview, understanding of Unite Us, and then we'll really hear from our users themselves before we get into the questions and answers portion of the discussion. As mentioned, by Jackie, my name is Jordan Murray. I'm the Strategic Sales Director, specifically supporting Texas. I'm here in Austin. A little background on me. I was fortunate to serve in the military. I went to West Point at the United States Military Academy and had 8 years in service, including a couple deployments overseas. So really service has really been at my core, really in my entire adult life. And as I transitioned out, I worked at Johnson & Johnson in the healthcare setting and saw really the fragmented nature that I think many of you all probably experienced, which then really opened the door for me at Unite Us to really help close those gaps. So I'm also here joined from a fellow veteran of mine, Brandon White. I'll allow you to introduce yourself and then pass on to our guest as well.
Hey everyone, good morning. Brandon White here. Thanks, Jordan. I'm located here in Houston, Texas. I am the customer success director here. Been at Unitas for several years, and I have a very similar story to Jordan, so I won't belabor that, but definitely agree with everything he said, and I love the work that we've done here, and I hope that we're able to showcase that a bit, especially with our guest that we have today that you'll hear from a little bit later, but I'll allow them to introduce themselves, starting with you, Antoinette.
Good morning, everyone. My name is Antoinette Lewis. I'm a community health worker and lifestyle and diabetes coach here at UMC in Lubbock, and I'm excited to tell you about how awesome Unitas really is.
Hello, good morning. I am Vanessa Morleone. I'm the Director of Community Impact here at the South Plains Food Bank in Lubbock, Texas. So I'm excited to kind of share with y'all how we use the Unitas platform and hopefully answer any questions that you all have.
Awesome. Well, thank you both for joining us, and really looking forward to hearing your all's first experience. For those of you that may not be aware of Unitas, just a little background. We were formed in 2013 and specifically started out serving veterans and military connected families. Like Brandon and myself, our co-founders were veterans, and as they transitioned out, we all quickly realized that all of the resources that were on the military base are no longer there, and trying to coordinate that was actually quite a challenge. So the one thing that I think we really quickly realized is in that population, although the co-founders, they were putting out resource directories that were continuously being updated, they weren't meeting the needs of our veterans and the military families, and that's really where Unitas was born as an outcomes-focused solution. And that's a theme that you'll continue to hear. And what is an outcome-focused solution? It's really understanding, can we prove an individual is actually connected to a resource? And if they're connected to that resource, did they have their need met? And that's really for the first, about 5 years of Unitas, we were serving the military family population. It was a perfect subset of the American population. And as social determinants of health became more of a buzzword, or as what us Texans like to say, non-medical drivers of health, that's when we really started to expand our services to supporting all populations, because the proof was there and the need was there. And we've continuously scaled to where we're now, over 10 years old, leveraging our closed loop referral technology, over 1,000 customers, and then, tens of thousands of network partners who are actively participating in our network. And that is across these sectors you see here, whether it's government, healthcare, social services. We really do support an any door approach to supporting all clients and their whole person health. What we're really going to focus on today is our core offering with our platform, but we also have complementary solutions that address needs upstream with some predictive analytics. CMS actually recognized the Unitas Social Needs System Score as one of the valid tools to really stratify risk among the social score setting. And then we also, again, have the platform for actually delivering services, and then also sustainability in this effort around payments. And you'll hear more about how we are driving payments into those community-based organizations to really drive more sustainability on social care and raising that priority level to the same priority level as healthcare. So as we kind of fast forward, and really what is Unitas doing today? The same thing we've been doing the last 10 plus years is connecting people to care. And this is a really simple scenario or use case. We all know that there are nuances to every individual's journey to care. But for Tom, for instance, let's say he shows up to Sue's organization. Sue, let's say she is a Unitas user. It could be any type of user, whether it's healthcare, government, social service. And she's able to conduct a screening of Tom within the Unitas platform. We are screener agnostic, meaning we can actually import your own screening that you currently use, or we can also use the embedded, established, validated screening tools such as Prepare, Accountable Health Communities, or what have you. And based on those responses, if Tom agrees to having his information shared across the Unitas network, we then capture his consent to conduct a referral. We are a HIPAA compliant, high trust certified platform. We adhere to 42 CFR Part 2. So the role-based provisioned access ensures that you only have information that's need to know to serve clients. And that's where the referral process takes place, where we can capture consent in 50+ language to allow Sue to share Tom's information across our network of partners. What does that do? That allows a referral to take place in our ecosystem, our digital ecosystem, in real time, so that the receiving organizations can either accept the referral, reject the referral. They can send it on to another organization. And at that point in time, Sue will see in real time if the referral was accepted or rejected, and she needs to act upon it. If it's accepted, it then becomes a managed case. A managed case is that intervention. And that's what we define as really, okay, if it's a food need, maybe that intervention only, is open for a couple of days until the outcome or need is resolved. Or let's say it's housing. It may take, they may have to go on a waiting list. That intervention or managed case may last a month or two. And that's really the kind of breadth of Unitas, the ability to really track the entire care journey of an individual, all the while providing feedback along the way. When we talk about feedback, it's not only on the referral, but it's also on that intervention or managed case is what we call it. So that's where, if you look, when you talk about interventions, how do you really know what is or is not working? And that's where I think, if you are talking to any type of closed loop referral vendor, you always ask, what do outcomes mean to them? Because outcomes mean different things to different vendors. And at Unitas, I can speak to ourselves, is we have structured data sets, or really structured outcome options, over 700 of them, that really create consistency in the way that these outcomes are being reported. We have over 20 parent service types, from food, transportation, housing, spiritual enrichment, what have you, and over 150 subtypes within each of those, such as individual and family support. A subtype is childcare assistance. And within each of those subtypes, there are detailed outcomes to really help with the reporting aspect, so that we can really understand what is and is not happening in the community to really make more strategic decisions going forward. When we look at the outcomes, it's really kind of twofold. The first is looking at the resolution status, and we're looking at whether or not a need was resolved or unresolved. That is the binary approach to understanding whether or not an individual had their need met. And depending on how that response is, we still want to know what actually happened. So diving deeper to know, okay, if it was resolved, and let's look at Tom here on the right-hand side. Let's say he had a clothing and household. Let's say he had 3 different needs around clothing and household goods. Furniture and home goods being a subtype, his need was resolved and he had received furniture. So that's that detailed structured outcome. We look at, the toiletries, personal hygiene products. That need was also resolved, and he received toiletries, personal hygiene products. Well, let's say that, they had capacity issues, and his need for clothing was unresolved, because there was no clothing available. We're able to then capture that outcome, whether it's positive or negative, to really understand what is or is not happening, so that we can better allocate and direct resources into the specific communities, not only for the individuals, but also the aggregate as you start to get some of that information. So as you can see here, our approach to outcomes is very robust. And really it is far more important to capture all of these detailed outcomes versus just simply reporting that someone got help and you have no other understanding of what that may be. The other really, unique offering that we provide is everything is built on a really comprehensive social care record. So as we were talking about Tom, it's all built on an EMPI, or Enterprise Master Person Identifier. So it's a unique record within Unitas that is created for every single individual. Very similar to those that, maybe there's a hospital ID or member ID from a health plan. This allows us to create consistency and understand of Tom's journey if he's being served by multiple partners throughout the network. Whether it's the health system, whether it's a community-based organization or a health plan or government agency, you all have visibility, because more likely than not, a lot of you organizations may be serving the same clients, but you're not aware of it. And Unitas is that enabling tool so that you can understand, oh, we see that Tom has had other needs around, clothing and household goods. We are helping him with his benefits navigation, and he's currently a patient at our local community health center. How can we understand how to correlate all those more whole person needs so that he has better health outcomes outside the clinical setting and in the community? Maybe he also has employment needs, right? Are there employment opportunities to get him connected to more self-sustainability? So that it really allows you to have a comprehensive view of his individual experience. I also want to caveat here, right? There are, again, provisioned access to where sensitive service types, such as substance use treatment or domestic violence or legal support, there are protections to ensure that those interventions and interactions are protected only for need to know. So if you have no involvement in that interaction, you're not going to have any type of visibility into Tom's experiences around those sensitive service types as well. The other piece is understanding the importance of workflow, right? Is, every organization has their own unique systems of record. We recognize the importance that although you can leverage the web-based application that's also mobile friendly for Unitas to do all of the work in Unitas, some systems of record require an integration or some sort of interoperability or API connection to streamline that workflow, especially in the healthcare setting, or even maybe from a government agency or what have you, where there are certain requirements to use a certain system, and entering duplicate information is not always beneficial on the end user, especially around efficiency. So we have continued to build upon our robust partners, as you can see here on the left, and we continue to roll out innovations in this. I think one challenge that you will all see is, as there lack standards around social determinants of health or non-medical drivers of health. We are very active in the Gravity project. We were actually leading a project around our payments innovation in the space to really create some consistency as we get more and more attention nationally on really everyone having a common kind of denominator and how they approach social care, since it is so closely tied to healthcare as well. As we take a step back, not only from the individual experience within Unitas, but also understanding, okay, well, how can we leverage that de-identified aggregated data throughout a community, whether it's your own organization, or let's say it's your county, or, let's say region, such as some of the work we're doing in the Rio Grande Valley with Valley Baptist Legacy Foundation in tropical Texas. We have the ability to create access for information around our Insight Center to know what is or is not happening well within our network. Do we have enough partners around these certain service types in this geography based on the demand that is being realized through our platform? How long is it taking for referrals to be accepted for these individual organizations or needs? What is the resolution rate? Are there gaps because there's capacity or funding issues? We're able to take that structured data that you saw earlier from the outcomes and create consistency so that we can, again, make more policy or even strategic level decisions on how we are approaching this work in the community. This is one example, our network activity dashboard. I know it's fuzzy, but this data is accessed via Tableau. You have access to Tableau dashboards that can be filtered down to your, again, organization level or regional level to really understand, what is or is not happening within the network, whether it's within your specific organization, whether it's identified partners that you fund, whether it's just your region. You're able to really start to delineate and those service delivery metrics, again, are going to inform how you are creating strategies to deliver that care in the community. Another one that comes standard is our health equity dashboard. And although the only information we require for a client to enter and unite us is their first name, last name, and date of birth to create that social care record, we really encourage the capturing of demographic information, because as we've seen more than ever over the last couple of years, that disparities among demographics around healthcare has really been a concern around health equity. So we can actually really drill down into certain demographics. Are they served in a more or less equitable manner in a certain geography? And why is that? Is a certain age group having a higher success rate versus another success rate when it comes to food related needs? Why is that? So we start to really empower organizations to take this information that has traditionally not been accessible unless someone's been capturing it in Excel and trying to extrapolate it themselves. This is giving you that access to really informed decision-making moving forward. So let's take a closer look at Texas. We've been present in Texas since 2017. And, I will tell you, what's I think incredibly important is you can see that we've had over 36,000 individual social needs met. And this isn't looking at searches, this is tied to individual records. And this is actually a 79% resolution rate. So we've had over 45,000 closed cases or process cases. Those are those interventions, right? And a 79% success rate in resolution and having those social needs met, which I think we can really be proud of the work that's been done. But you can also say, hey, what about those other 21% where the needs weren't met? Why was that? Were there capacity issues? Did individuals not show up? Do we need to start, capturing additional family members or contacts to make sure that those transient populations that are really tough to serve, that we have ways to engage with them and make sure that they don't
Understand. Just
on the other side, I want you all to understand when we look at Unitas as well, our programs within Texas, we've got a little over 1,750. This is all based on those programs or organizations that have opted in to using Unitas. That's what our really motto is. We're not just simply saying, hey, we have hundreds of thousands of resources within our network. No, these are active organizations that are really engaged and they've agreed to our network standards. Our network standards are driving accountability. It's not exclusivity agreements. It's simply ensuring that organizations keep their information up to date at all times and they're responsive to referrals in a timely manner. This is one of those instances where the more accountability and commitment from these organizations, it's going to rise tides and lift all boats and ensure clients are getting served better. Out of those programs, we have 14 contracted customers throughout Texas. So what we really take pride in is we don't charge for access to Unitas for community-based organizations or safety net systems. We know that there's always a gray area there, but our business model is sustain this work through traditional healthcare contracts and government contracts that can really ensure that we are helping subsidize those organizations that really don't have the means to support this type of work. And you can see here, we've served over 21,000 Texans, almost each of them, going up to 36,000 actual needs. Referrals, so we've had over 29,000 referrals. Those referrals, we've had responses within 3 or fewer days in over 70% of them. So again, there's still opportunity for improvement. We would love to get everything below 1 day, but we are continuously driving and improving beyond the national averages that are well beyond 10 days. So you have visibility in what is or is not happening in your backyard. And then on the right here, when we look at the top needs identified, it's probably not a surprise, but food assistance, transportation, housing and shelter, clothing and household goods, and utilities. Those are the top 5 needs that we've seen that have presented themselves throughout the Unitas network that is present throughout Texas. So again, just helps us understand what the needs are so that we can better inform our strategic priorities as we are hopefully the preferred tool for organizations really providing this meaningful work. We cannot do any of this stuff if we didn't really prioritize privacy and security for this information sharing across sectors. You can see some of the certifications, regulations, and the access and permissions that we approach, along with our infrastructure. We can, nerd out on this for days probably, and I'm happy to share our 10+ page comprehensive security overview. But we're contracted with over, I believe, 20 state agencies across the country supporting this work, not to mention local government, healthcare systems, amongst other nonprofit leaders as well. So again, this could not be, we could not do this work if we didn't prioritize privacy. And the reason I would really want to, highlight that, and it's not because I want to tell this, but unfortunately, although we focus and really focus on speaking on fact on our capabilities, unfortunately, some other vendors out there don't do that, and they will spread mistruths, which, having been at Unitas for almost 3 years now, we now have to address them head on. So we really, I'm not going to dive into each one of these, but I want to make sure that the slides that you get after this, you understand that, it's false when they say that Unitas does not require consent for each referral. A consent is required upon any type of information shared across our network. We also never will sell any client data to third parties. Any organizations participating in Unitas, you own this data. You can export this data and really at any point in time, remove it at your own will. We also don't impose exclusivity on community-based organizations. We know that different communities may use different systems, and that's completely fine. We are one of the many systems out there, and there is no requirement to use Unitas from our standpoint. Some of our partners, they may have MOUs with some of their funded partners. They may say, hey, based on the funding you receive, we ask you to use Unitas. That is not our policy. That may be some of our partners, and that's completely their prerogative. We also make sure that individuals cannot access services unless they agree to Unitas consent. That's false as well. We can share resources without any type of information being shared across our network. And then again, the whole network can see your patient's referrals. That again is false as well. We adhere to 42 CFR Part 2, and that our role provisioned access ensures you only see the information that you need to see. So sorry I had to point that out, but again, it's something that we have to hit head on just based on any of the narrative that others may be saying about us. But if you have any questions about Unitas, we're an open book. You're more than welcome to always reach out to us. So now for the demonstration, and this is really going to be an expedited, really just kind of an overview, because I will tell you, for those of you that have already done a demo with me, we can do this for hours. Last week, I just did one with the city and a county that lasted 4 hours over various scenarios. But we want you to see the interface of Unitas, which again is a web-based application. And when you log in and do the referral process, you're capturing the information in a seamless manner. And you can actually see we're serving Tom Adams here. And the benefits eligibility screen, you can actually do a referral to multiple organizations. Whichever organization accepts a referral, it'll automatically recall from the other organizations as well. So you don't have duplicate referrals out there. You can add documents, you can add supplemental information. And when you review the referral, you're reconfirming their consent process as well. So it did a complete cycle there. But as you look and it goes out into the Unitas network, it then goes into our dashboard. So any user that's accepting a referral, they can take action, accept it, enroll them in a program and assign them to a worker. And then that becomes an internal case. When they close the case, mark whether it's resolved or not, what actually happened. Okay, they received services. You can free text what the details are, and you can close the case. So it's important, not only the individuals actively engaging in this, but if you sent that referral, you have visibility into this entire journey as well. So you have confidence whether or not an individual that you sent for a referral, if a food bank or benefits navigation organization accepted the referral, you can see whether or not they had a positive outcome or not. So that's a very high level overview of our demo environment. A lot more to unpack, and I'm happy to always do one-offs because again, it can be very robust. On the other hand, I do want to really reinforce the importance of outcomes. So we actually, when I started about 3 years ago, selling this technology, everyone wants to know ROI. I mean, absolutely, it's a very valid question. And that's where we actually partnered with Sarasota Memorial Healthcare System in Florida to do a really robust evaluation. So in 2018, Sarasota Memorial was designated as the backbone organization for the first 1,000 Days Suncoast Initiative. That was specifically for 85 plus partners to really increase care coordination and access for pregnant mothers and their families with young children. The first couple of years, they did not have a system like Unitas. So in 2020, they contracted with Unitas, and we were able to do an actual case matched, or let's say a retrospective matched case control design, where we had about 2,500 individuals, where you can see there's a control group, and then there's the case group, which were connected to services through Unitas. So you're comparing two cohorts, pre-Unitas through traditional manners, and then post-Unitas when they're actually doing more care coordination through our accountable outcomes-focused solution. And the main takeaway that you'll hopefully see here is that we did actually show statistically significant reduction in odds of hospital readmissions up to 12 months postpartum. So the care coordination workflow as it was designed, and again, these are all unique to every organization. We work hand in hand with our first-in-class customer success team, such as Brandon or Claudia that you may see, or Kathleen or Nicole that I think may be on the call as well. But at Sarasota Memorial, they did a brief SDOH, or let's say in Texas, NMDOH screener upon admission for labor and delivery. If they were positive, they were then alerted through the EHR integration to a care manager, or a case manager, I should say. And that case manager was able to do a more thorough assessment and identify what are the actual needs, and then conduct that care coordination through Unitas. So let's say Ellen, this new mom, throughout that workflow, we were able to show that, upon, prior to discharge, we knew that she was going to require home visiting services and food assistance. So upon discharge, it was giving her a lifeline to supplemental support outside the clinical setting to ensure that she as a new mom had the support that she needed. So as we did this, we were able to show the top 5 service types for those members or patients that were referred throughout this experience. So you can see, probably not surprising what you're seeing on here. But again, this is part of the outcomes, not only from the referrals, but then from the outcomes as well, from the interventions. This is what the results that we saw. 30 days postpartum, we were able to show there was a 79% reduction in odds of postpartum related readmissions for Medicaid patients. we're looking at 70% reduction in odds of all-cause readmissions for Medicaid patients. And although not statistically significant, reduction in odds of postpartum related readmissions for private insurance patients as well. Again, that's 30 days. We're extremely excited. And I will tell you, our partners at Sarasota Memorial, they said, we're not surprised, but we now have the reliable data to show the work and impact that we're doing. We look at this continuously over time, though, not just at 30 days, but at 3 months. It's still at 64% reduction in odds of readmission, 57% at 6 months, and 53% readmission reduction in odds of readmission at 12 months. So again, those are postpartum related issues. Let's look at those all-cause hospital readmissions. They all reduce significantly compared to their control group, which again reinforces you need to focus on outcomes. So again, based on that, demonstrated value, they were able to really expand this across a more system-wide implementation across Sarasota Memorial, and really serves as a great example of, although you may not be a health system, you may be a foundation, or you may be a government program or health plan, you can mimic this own type of study based on the population that you serve as well, because we give you that consistent data that you can really make informed decisions on. So why unite us? At the end of the day, we again are that trusted and proven closed loop referral solution since 2013. That's over a decade of experience of doing this referral and care coordination. So as other organizations or vendors may have started out, as a resource directory or some other solution, very few organizations have the depth and history and knowledge of doing the actual closed loop referral solution as we do. Again, when we look at just what you saw with Sarasota Memorial, we are enabling these cross-sector partners across government, healthcare, and social services to power those transformations, and really through policy and strategic decisions because of those structured data points. We actually just had a recent conversation with an MCO in Texas, and they were in hopefully the contracting phase now. And they told us, we said, hey, look, we are transitioning to Unite Us because this other vendor, they're good for outputs. They can give us outputs, which is great, but we need outcomes. And that's why we're coming to Unite Us. And I think that is really a great way to distinguish of when you consider the different offerings that are out there, ask what outcomes mean to those organizations. And then we can show you again, is from this presentation, what it means to us. Again, we always prioritize privacy. Our ecosystem really ensures a reliable ecosystem for that sharing of information. And then lastly, we are driving industry standard billing and payments innovation. We have modules that layer on our technology. North Carolina is doing this through their 1115 waiver called the Healthy Opportunities Pilots, where last year we helped with the reimbursement for community-based organizations over $30 million in invoices to reimburse non-medical needs, food, housing, and transportation. And we were actually mentioned in the White House published in November a playbook to address social determinants of health. We may have to rename it for Texas, of course, but we were the only technology company mentioned in that entire playbook based on the work that we're doing in our payments innovation in this space. So again, we, in my opinion, are the market leader here. Everyone else may say they can do what we can do, but I will tell you, peel back the layers of the onion and ask questions to understand what they're really offering versus what we are offering, as you have hopefully seen here today. So I use that as a transition point. So thank you for letting me belabor on longer than I probably should have. But background on our City of Lubbock contract, which we were awarded through competitive procurement, they had already stood up a care coordinated type of ecosystem, and the technology was sunsetting. So we had an opportunity to bid on this work a couple of years ago, and we were awarded where they had this collaboration of partners, which you're going to hear from here shortly. So I'm going to hand it over to Brandon White, who is my colleague, obviously, as mentioned, that leads our customer and community success work, to kind of continue this conversation.
Appreciate that, Jordan, and appreciate the brief overview. And thank you all for the questions that you have coming in the chat. Keep them coming. We'll try to get to them before we end the session today. And if not, we'll get back. We'll find a way. We'll work with Jackie and team to figure out how to answer those questions. But what we want to do now is transition and allow our two guest speakers, Antoinette and Vanessa, give you a little taste of their experience with Unite Us, what they think about the organization, their ability to track the outcomes, and how they work together. So I will start with you, Antoinette, and would love for you to start with your experience at the beginning with Unite Us, some of the things we've talked through about connecting patients to care and your relationship with the food bank.
All right, so again, like Jordan said, UMC chose Unite Us because they focus on the closed looped referral system. We had a previous platform, but not able to connect a lot of patients. The social work team, of course, has patients come in the hospital or the clinics. So my job is to connect patients in the platform, and that allows us to not only give us all handoff to that patient. They have somebody that they can call back and talk to directly, but putting them in the platform, getting them connected to that resource, and then going back and closing the loop. As Jordan stated, the platform is super user friendly, so you can go in and if the referral is denied, you can go see that. That way I can reach out to someone else that may be able to connect. So it's just been really amazing to see the work that we've been able to do, especially with the food bank. The referrals are usually answered in 24 to 48 hours, if not sooner sometimes. So it's just really been amazing to see the referrals, people be connected, and for me to be able to call back and say, to confirm that the patient has been connected. So it's just really been amazing. I really appreciate Unite Us because the team is so much, they're so engaging and concerned about our partners responding to referrals, who else can we onboard. I had a client that I referred in the portal that actually was in a rural community and that I wasn't familiar with any services. And so I went ahead and put them to the closest organization that I thought would be able to help them. It was denied, but that organization was able to tell me about a resource that I had no knowledge of. So I was able to then, make it an out-of-network referral and still get that patient connected. So if I had not put that patient in the Unite Us platform, I would have never known that.
Awesome. I love that. Can you talk, Antoinette, a little bit more? You were telling me this last week about the traditional workflow that you use, how you get to understand that patients have needs. And then also you talked a little bit about being in the community and then leveraging the platform when you see stuff that needs to be addressed.
Sure. So being a community health worker instructor, I'm boots on the ground. I come across all kind of people, all kind of needs, all kind of barriers and situations. My normal workflow is here at UMC, we have now a form. It's called, we haven't changed the term non-medical drivers of health yet. So we're still using SDOH. So all of our patients, whether it's in the clinic setting or the hospital, had a social determinants of health form. And that's just a series of questions. Are you food insecure? Do you need utility assistance? Social isolation, literacy, it's a number of questions. And so when that patient fills out that form, it triggers for me and Cerner to pull that patient up. At that point, I'm able to call that patient and say, hey, I noticed you were in our clinic and stated that you need some resources, of course, get their consent. Really easy for that because I don't have to take a lot of time to email them the form unless, of course, the patient wants more information about where their information is being input. I'm able to put them in the system and right away get that service connected. Again, like I said, even in the hospital setting, if I'm outside of work and I know of someone who needs a resource, I'm able to also get them in the platform. Hey, do you mind me putting you in a resource portal that'll help me better serve you to learn about resources that I might not know about? So yeah, that's how that pretty much goes.
And the last question I think I have for now is any lessons that you would share for this audience. Some of them are familiar with us. They're partners on the platform now, but a lot have never heard of us or haven't heard much. Do you have any lessons that you share or things that you would think that they should consider as they're looking at us as a potential solution for them?
Oh, yeah, I've never felt more included in a process. We have monthly meetings where we sit with the team, Nicole and Kathleen and Ari at the city of Lubbock, and we're able to, they want to my feedback and to know who else we can get on board. They also show me the work that I've been doing, and that just empowers me to keep going. I don't think we've had a platform that has been so engaged and connected, and it just really, really helps for me to be motivated and keep using the platform, and also to know that, you know, my work is not in vain. A lot of times it's disheartening to see how many people out there need resources. So in my opinion, I mean, you guys have really helped my day-to-day workflow run seamlessly. And it really is, like I said, if you have any input, they're on it. You know, they want to know what your opinion is about how it's going. So I definitely appreciate you guys for that.
Awesome. We appreciate you as well. Thanks so much, Antoinette. And switching gears a little bit to you, Vanessa, would love to hear about, in your role as the Director of Community Impact. I know you've held several other roles at the food bank as well, but tell us about your experience with Unite Us from the beginning and how your organization has leveraged the platform.
For us, we utilize Unite Us. We get referrals. Antoinette sends us quite a few referrals from UMC side for food assistance, and we're able to expand our reach through this platform. A lot of people don't know what else we do, and so allowing us to open up on this platform and what we can do as far as help with SNAP applications, food assistance, of course, getting that reach out even further. That's how we utilize Unite Us, and to be able to help as many families as we can. And just seeing the many referrals that we get in a week, and that allows us to be able to help those families. A lot of them are families that we've served before, but it's been quite a while. But just the way the platform is built, it's so easily, it's user friendly. I like to use that a lot. We get all the information that we need on our end to be able to put into our system that we use. That's very helpful for us to get in contact with the client with if we need any additional things from them, we're able to call them directly. But it's very easy for us to get them into this platform, or from this platform into our system, and be able to give them a call and say they can come pick up their food box. And it's a very easy process with Unite Us on the referral side.
Awesome. Can you talk a little bit more about, because I know this to be true with every food bank I've ever talked with, time is of the essence, right? You guys are extremely busy. You have things going all the time, and it's hard to get a hold of you because you're doing the work that the community needs, which is a beautiful thing. Can you talk a little bit more about the impact of the platform on your ability to be more effective, efficient, or whatever you think could be relevant here?
Yes. So the way we receive our referrals is it comes through an email. So if I'm not in my office, I constantly have my cell phone where it comes through the email. So I'm able to receive that referral. There's maybe 3 of us on my team that have access to Unite Us. And so they're able to get that, or I can relay it to our community SNAP team, and they can get all of the information they need, and they can reach out to that person. So that's how the process is usually streamlined, is because I get those email notifications as soon as I get the referral, and I can get that done as soon as I can. And so just us being in and out constantly, or me especially, I'm in and out of my office, but I can get that easily done very quickly. And we strive on getting our families help as soon as possible. And so just getting those emails can make me get that done quickly and effectively.
Yeah, absolutely. Thanks for calling that out. And I love that. And just for a point of clarity, because I know we didn't get to dive into the demo as much. So Vanessa has the notifications in the platform turned on to send her an email so that she knows when to log in and send that referral, whether it's her or her team. That's something that a lot of people leverage, but you can turn it on or off, because there are other organizations that keep it off because they're always in the platform. So they don't necessarily need that notification. Two more questions I have, and then we'll open it up for Q&A. Same thing that I asked Internet. Any lessons you share with those considering a platform like ours, like things they should be thinking about, questions that they should be asking, things you wish you'd known before signing up to the platform?
I think more so we are, the way we use it is a little bit differently than what Internet uses it. We are on the referral side, but just it's so user friendly, and that, you know, they're helpful in any ways that they can. And just the information that you receive from that, whether you do it for, like for us, for food assistance, which is one of the top drivers that we have in Texas,
Yeah.
that is very useful for us. And just being able to, like I said, expand our reach to different people who don't know what we do or who don't know what we can offer. That helps us a lot. And this platform opens that door for others to be able to reach us and showcase what we can do to help those clients.
Awesome. Thank you. And last question, this is actually for both of you, whoever's comfortable with answering. You know, we like to talk a lot, and you heard Jordan say this a lot. We really focus on the outcomes, because that's where the rubber meets the road. Like, are they getting the care that they needed in a timely manner? So would love to hear either one of your takes on how you guys leverage that outcome data to make decisions moving forward, or maybe how you could see yourself using that data to make decisions in the future for new programs or current programs or funding, et cetera.
Okay, well, I'll answer. Right now, Lubbock is in the process of doing a community assessment to basically narrow down what are the top needs in the community. Of course, we know food, homelessness. So having transportation is a huge one as well. So having this platform, I'm able to track. My boss is actually the vice president of supplemental funding and has participated in that process. And we're actually going to be moving forward next month. So we're able to take the data that I'm entering, not only in the platform, but also on my end of just keeping a running spreadsheet of all the needs. We're able to show this in real time, you know, that we're not just making up these concerns. This is what the needs are, and hopefully we can get more organizations involved and more people in leadership and at the top involved in helping our community to address a lot of these barriers that ultimately affect a lot of health issues that we're seeing and other things.
100%. That's a great example. It makes a community assessment so much easier when you've been doing something like this for a while, and you can point to that data there. Vanessa, anything to add?
No, I agree with what Internet said. I think for yeah, no, I agree with everything that she said. That
All
really
good.
that a lot, yeah.
Yeah, thank you. Appreciate both of you all again for spending the time to talk a little bit about us and what we do and your experience with us. Also, I'd be remiss if I didn't shout out the LBK community. I think I saw Aria on the call. You guys are the reason that we're out there in Lubbock, and what you're doing for that community cannot be overstated. So thank you all for all the work that you've done. And with that, I want to go to the next slide and open it up for questions. Would love, if you have a question, you could raise your hand, and I can call on you and come off mute, and then Jordan and I, and if it makes sense for Internet or Vanessa to answer, we'd love to answer any questions that you have. I know we have a couple in the chat, so Jordan, let me know if there's something that we can address from the chat here during Q&A. We have about 10 minutes, so we did pretty good on time. If you can't find the hand raise, feel free to just come off mute and ask your question.
I saw Melody, you had, like, can you go back to the facts slide? Is there one in particular?
While we get back to the slide, I know there was a question that came through the chat. I forget who it was from, but it was about the Rio Grande Valley and recognition that we're more limited resources on the platform and the plan to increase those resources. Maybe you could talk a little bit about that before we get back to the fact sheet.
Yeah, I can start and address that. So This is again where I feel like I'm using this term too much, where the rubber meets the road too, right? You can only address needs with resources that are there. So first question I would have is, and I'm fairly familiar with the Valley, but are there resources there and they're just not on the platform, or do they not exist? So we spend a lot of time on our own and with our partners. We have lots of great partners down in the Valley trying to understand what needs are not being met. And then we try to come up with a plan to address those needs. And we have a dedicated person in the Valley. She actually lives in the Valley, who spends actually probably all of her time trying to communicate with organizations that aren't on the platform that we know would be a value add to the platform, or we would just like to introduce to it. We also love to ask people who are on the platform to introduce us to other organizations to get them on the platform. That warm introduction goes so much further. Like, obviously, me as a Unitas employee, I'm a big believer in the work that we do, but it means so much more, which is why we had the testimonial today, to have someone that's lived the experience in using that platform that can have them on. So that's a big part of the work that we're doing there. Jordan, I don't know if you want to add anything based on your conversations with Valley
I know
Baptist.
that, like, we are fortunate to have some great champions down in the Valley. Judy, I think, if you didn't catch her earlier on, and I know some of her team is on, as well as Tropical Texas, they invested with Unitas to expand kind of some of the veterans work that we had done in years past, to really focus on the Valley and expand this work. So a lot of it does come down to education and awareness, trust building, and prioritizing of those strategic initiatives. And that's exactly what's happening right now. I know I was invited down. I'm going to be down in a few weeks to do a presentation to some of the community members. I would love to say that, hey, we just flip the light switch and there's providers or users across Unitas. It takes time. If you look at Unitas in North Carolina, and I'm going to reference them just because they were the first ones to approach a statewide type of approach. We started out with 200 programs in 2017 serving veterans. When they did a statewide contract from their Medicaid agency, that's when we actually scaled out to 100 counties, all 100 counties, and we had about 1,500 programs by June of 2020. To date, I believe we're over 7,000. So this is a continuous kind of evolution of building momentum, collaboration, and trust to show that, hey, we are a solution that can work for many organizations. Whether you're a food bank, whether you're a homeless shelter, whether you're a government agency, we can support all of the different use cases leveraging the same backbone technology.
Absolutely. Melody, I see you came off mute. Did you have something to add? Go ahead.
Yes, Jordan, thank you again for your service as a fellow veteran. I appreciate all the services you do for our veterans as well. My question was in regards to real-time availability, and I know you said that you have to work with the CBOs. So for instance, a lot of times when we're looking for resources such as rental assistance or utility assistance, stuff like that, a lot of the CBOs tend to run out of funds, and I get it. But real time, how does that work with Unite Us when we're trying to refer members?
Great question. So when we talk about, so organizations have the autonomy to update their information in real time. So when they log into the platform under their organizational settings, they can actually turn off program referrals in an instant, and they can show the reason why. Funding, capacity, maybe Brandon's running the program and he's on vacation for a week and nobody else is there. So that's what really empowers organizations to own their own information versus a resource directory that's generally out of date by the time it's printed, right? And that's something else where, again, not only, I'm going to reference again, like the Valley, Judy and her team provided a list of 75 partners that they want us to engage with. We can't force anybody to join Unitas, but we want to educate them and show them the benefits of them joining. And I think that also kind of goes into Andy's question, right? Of how do we help facilitate or support payments? So we have different, any funding arrangements that happen between organizations, whether it's a fee for service model, which you can look, that link, I put a few questions up for the Healthy Opportunities pilots. There's actually a fee schedule where the funding from the 1115 waiver, basically CBOs can invoice for the services that they're providing through Unitas, and then it gets basically triaged to one of the MCOs, which will then reimburse. That's the model in North Carolina. Santa Fe, for example, in New Mexico, they received the National Association of Counties Achievement Award in 2022. We partnered with them there, and they were doing direct payment assistance from CARES Act and ARPA dollars, right? So they were able to, again, it's really giving billing capabilities to community-based organizations that they've never had beforehand, and it creates consistency. There's authorizations involved in some instances to really help with control measures. So when you see one payments customer within Unitas, I'd like to say you've seen one because they're also unique, but we see consistency starting to come out. And that's why that's actually the work group that we are leading for the Gravity Project, is around our payments innovation for those community-based organizations.
Thank
Thanks
you.
for your answer. Really appreciate it.
You bet.
Any other questions? I think there's one more that I did touch on in the chat, but I can expound on if there's not anything else right now. So one question was, do organizations receiving referrals need to have Unitas as well? And I said, short answer, yes, if you want to realize the full capabilities. If you're not a user on the platform, then you would have no way to receive that referral through our closed loop referral platform. There are ways, and Antoinette actually spoke to it, and when she gave a testimonial, where a sending organization can create what's called an out of network case, which means there's an organization that's not on the platform yet, but they want to be able to track that data and make sure that they understand what happens with that patient. And that's something that they would just do on their side and ask the patient to go see the services that they're seeking. So if you want to use the full suite of services with the platform, then yes, being on the platform is the ideal scenario.
Great. Well, this has been a really robust discussion. And first, I want to thank Jordan and Brandon for making the time to fill us in on how Unitas works and the capabilities. It's a great tool. Vanessa and